My name is Carmen Logie. I'm a professor here at the Factor-Inwentash Faculty of Social Work at University of Toronto. I'm a social scientist and I'm a social worker. So I'm really interested in the social determinants of sexual health in my research with a focus on HIV, particularly looking at social hazards such as social inequalities, stigma, discrimination, and environmental hazards such as extreme weather events like drought, flooding, wildfires. One example of how our work has affected Canadians is our work in the Northwest Territories with FOXY, Fostering Open Expression Among Youth, a Northern and Indigenous sexual health organization. So my role specifically has been to help evaluate the school-based workshops and fly in peer leader retreats to see the benefits among youth. We've been documenting impacts on empowerment, on safer sex practices, and on HIV knowledge. In 1994, I was actually an undergrad here at University of Toronto, and I was invited to volunteer on what was then called the AIDS floor of the Wellesley Hospital. One thing that really struck me was that a lot of people were dying alone at that time, and they were dying alone because of the stigma towards HIV, but also the stigma towards affected communities such as homophobia, transphobia, sex work stigma, and drug use stigma. And I can say 40 years on, that stigma is still persisting and is still one of the reasons that HIV has not been ended. I love what I do because I love the communities that I work with. I also love coming up with ideas together, seeing those ideas to fruition and seeing how they might impact people's lives for the better. So we've done things like participatory theater, we've made comic books, we've made digital stories, and we work with communities who can come up with some really innovative, special, and exciting ideas.